Hello, everyone. Welcome to another session of Back to Basics. If you are watching this, it's probably because you are part of our tribe, the Natural Gut Relief. My name is Dr. Vivian Asamoah. Every Thursday evening, we always introduce you guys to an amazing topic and an amazing guest. And tonight is no exception. We have a wonderful guest who's doing something very different. I think revolutionary healthcare, and this is the direction we'll be going in, we should be going into, but I'll let her, the expert, tell you more about what she does. Her name is Dr. Chinelo Okoye. I'm right.
Yes. Hmm.
And we are excited to have her on our Back to Basics and Natural Gut Relief tonight. We'll talk a little bit more with Dr. Chinelo, but for those of you who don't know me, I'm Dr. Vivian Asamoah. I'm an integrative gastroenterologist practicing in West Houston, Katy to be precise, here in Texas. My practice is a little bit different because I blend the best of both worlds, conventional medicine with some integrative and holistic medicine, so certified in both. And we just like to bring the best and upcoming information, education to our patients. And tonight is no exception. Welcome, Dr. Okoye, to our platform. Tell us a little bit about you.
Well, thank you for having me. So, I am Chinelo Okoye, and I am an internist. So, what that means is I'm an internal medicine doctor, and I specialize in taking care of all the chronic diseases that we see in adults. So, starting from age 18 to 100 and something plus. And so that's who I am. That's what I do. Yeah.
Awesome. And your practice is where, tell us where your practice is located. And then finally, we're going to get into that question of how is your practice different because you're not like every other internist out there.
No, I'm not. So my practice is located in Katy, Texas, not too far from your practice, Dr. Samoa.
Yes.
And my practice model is called direct primary care. And you're right, it's a different model. It's not like what everybody else is used to. So what this model is a practice model where patients have a direct relationship with their physician or the practice. Okay. So the relationship is between the two of you. The doctor is working for you and not working for the insurance company or working for anybody else. The patients usually pay a monthly membership fee. And when they pay that fee, they can be seen as often as they need to with no copays. So patients usually can be seen by coming into the office or by texting, us directly through a special app or even by virtual visits. So yeah, that's what this model is about.
Mhm.
It's very personalized. It's
Mhm.
because we're not working for anyone else besides our patients, we make it very personalized, and we're able to really spend time with our patients as opposed to the traditional model where they may have just 15 minutes for you. So yeah, that's the basics.
That is awesome. So this model is called the direct primary care model, and it's possible that some members in our audience may already have DPC
Yeah.
doctors, and you guys can all chime in and tell us about your experience in the comments. Would really like to hear more. But as a specialist, a lot of my patients ask, I need a new PCP, or, it's usually because my PCP retired, my PCP is
Mhm.
not practicing anymore, my PCP was employed by hospital, and a lot of those hospital PCPs change very often.
Right.
So they're looking for someone who is going to be a primary care doctor that they can really stick with for a long time, many years.
Right.
Our patients miss that experience of when they're with the same doctor and maybe their kid is now an adult and can see that same doctor. We're
Yeah.
missing that with these hospital type, positions, employed positions. But I love what you said, Dr. Okoye. You said the doctor is working for you. So that's the value there. When you pay that membership, which patients pay to your practice, you're at the disposal. I mean, of course, reasonable. Your whole attention, your whole focus is geared towards the care of the patient in front of you. And
Exactly.
yeah, and this is so important because as a specialist who also takes insurance, some of our care is misdirected because we
Mhm.
are so controlled in many ways, unfortunately, by what the insurance will and will not let us do.
Exactly. Exactly. And that's the beauty of this model.
Yeah,
This model works for patients whether they have insurance or not.
yeah.
And the reason for that is, we are able to negotiate a lot of deep discounts in pricing for labs and imaging and things like that. And so patients are able to get some tests done through our membership pricing that perhaps their insurance wouldn't even cover.
Mm-hmm.
Just to give you an example, I like to, to explain with examples. So I had a patient once who I ordered a vitamin D level on.
Mm-hmm.
And so the patient wanted to try to get it through their insurance, and they went to the lab, and the lab wanted them to sign a document that said that they would be willing to pay about $500 for this test if insurance doesn't cover it, and there was a chance insurance wouldn't cover it. So the patient got scared and didn't do the test and contacted me. And guess how much the patient paid for this same vitamin D test through our membership pricing?
How much?
$13.
Wow.
Yes.
13 and 500,
Yes.
500 using insurance if they don't possibly pay. This is just
Yes.
your bill compared to 13.
Yeah. That just shows you how our system is. But yeah, this is just an example that really happened.
No, I'm so glad we're having this conversation because I truly believe our system is flawed. Just even you mentioning that the lab has you sign a form, almost like a legal document
Right.
binding you to payment of something they know when they test it only costs $13 or even less.
What is the sense? Yeah.
It's sense, right? And they're charging you 500 and taking that money away from you. It then makes you really question what is the value of my
Right.
insurance? And is the value of my insurance actually delivering better care, better
Exactly.
health care overall, or is it not? I'll be honest with you guys. I'm really on this conversation today because I am in transition to DPC. I no longer want to use traditional insurance for my health care because I realize that the DPC model is better in so many ways. Some of them we've mentioned: constantly changing doctors because the doctors are not happy in the hospital systems, expensive imaging and
Right.
expensive labs, even using insurance, right? So it's actually, you think you're paying, $1,000 to $2,000 a month for insurance, and you hope that your tests are going to be more affordable, but no.
Yeah. No.
Actually, working with a DPC doctor who has a membership program, who has alliances with very good labs, same labs that your insurance use, and imaging actually is much cheaper than
Right.
using more affordable, let's say, than using insurance. So, for example, Dr. Okoye, let's talk about CT scans. When I
Mm-hmm.
order a CT scan, the insurance is like, no, no, you have to order. I'm like, my patient, it has pain, left lower quadrant. I think they have diverticulitis. This is the first episode. I want to get a CAT scan. And the insurance is like, no, 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 denied. Denied.
Right.
You need to get prior authorization. I get a prior authorization. They tell me denied, denied. Have you done an x ray? Have you done an ultrasound? And I'm like, it's not going to help me. I need a CAT scan. Denied. So, unfortunately, what I have to do for the care of my patient is I send them to the emergency room and I say, just go there and get a CAT scan, which is unfortunate
Right.
because
Right.
it's going to cost them way more. So
Way
tell
more.
us about how you work with your patients who need imaging under the DPC model, working with you, Dr. Okodia.
Right. So it's pretty much the same thing as how we have discounted pricing with imaging. We also have deeply discounted pricing I mean, I'm sorry. I meant we have deeply discounted pricing with imaging the same way we have with labs.
Okay.
Very, very inexpensive compared to going through your insurance. Just to give you an example, because again, I like talking with examples.
Mm-hmm.
You as I said, the DPC model works whether patients have insurance or not, right? So I do have some patients that have pretty good insurance.
Mm-hmm.
And a lot of times when they compare what they would have to pay for the CT scan by going through their insurance with what the membership cash price is, they
Mm-hmm.
end up just deciding to go through the cash pricing because if you have a deductible, you
Mm-hmm.
have to meet that deductible, right, before
Yes.
your insurance would even kick in. So if
Yes.
you have a 5,000 dollar deductible, you're gonna have to come out of pocket a whole lot. So for instance, you can get a CT scan of the abdomen and pelvis for $200. Okay,
No.
the same exact CT scan of the abdomen and pelvis through insurance can be like $2,500. Okay.
Wow.
And so if you have a deductible of $5,000, you'd have to pay the 2,500, right? Um, when you can get the same exact CT scan for
Same
$200.
CT scan, same location, probably
Same
the same
location, even.
location, right? So
Yeah,
it's not like
same exact location.
it's not a lower quality CT. They are not lower quality radiology.
No,
It's the
no,
same location, same facility, same radiologist, high quality, doing
right,
the same thing. So this is a really important conversation, guys. In natural gut relief, we talk about taking hold of our gut, using food as medicine to heal our bodies. And sometimes we actually do need conventional, right? We need testing, we need labs, and we do this all the time. But this conversation is really about empowering you as a patient to take
right,
hold of what is value to you in terms of your healthcare, right? Is the insurance model really bringing you the value you need in terms of your healthcare? Or is working with someone like Dr. Okoye in a DPC model actually going to save you dollars down the road?
right.
For numerous reasons, Dr. Okoye, I'm just thinking there are numerous reasons why working with a practice like yours will save patients money down the road. Tell us how this may happen. I'm just from a physician's perspective, so many ways, right?
Yes. So honestly, the biggest way that this works is because we actually have time for our patients, right? So savings is not just about dollars.
Yes.
The time it takes to, diagnose something or prevent something from becoming complicated because they only had 5 minutes with you.
Yep.
You have a doctor who is devoted to actually taking care of you, who has the time. Our visits can easily run an hour. I've had visits go an hour and a half.
Mm-hmm.
And you're really spending time with the patients. You're really taking care of them. You're really getting all the T's crossed and the I's dotted. Then we take care of things before they become a big issue, where the patient has to be off work multiple times or has to go to the emergency room and has to seek care in expensive
Mm-hmm.
places.
Mm-hmm.
So yeah, that's number one. The
Yes.
savings by being able to spend time with patients, get them in early, diagnose them early, and
Mm-hmm.
then in addition, we also talked about the savings on labs, imaging, and things like that.
Mm-hmm.
So
Excellent.
yeah.
That's
Mhm.
really excellent. And the value there is not that I feel like when you enter a doctor's office, I know a lot of people get white coat syndrome.
Right.
But a lot of people get a lot of reassurance when they know they have time to talk to their doctor,
Yes.
explain the situation, maybe even explain their family history, talk about certain things that they may even be anxious about.
Right.
And that having that conversation, being able to have a doctor who's sitting down, not rushed, not half standing about to get out of the door,
Right.
who's willing to listen to your entire family history or anything that may be causing anxiety is healing in itself,
It
right? It
is.
is
It
very
is.
therapeutic in itself, right? So those are some advantages that I just don't think you can buy with insurance.
No, you can't. And the other thing, just to add to what you said, because we're not, working for the insurance companies or working for anybody else besides our patients,
Yeah.
we're able to do certain things that, make for instance, just to give you an example, let's say you have a patient who comes in and is worried that they might have, like an inflammatory bowel disease, for instance,
Okay.
in your, your experience, inflammatory bowel disease, and they're discussing things, and they would like some testing done.
Hmm.
Well, in the insurance world, you'd have to have certain symptoms and things before the testing can be ordered, right?
Hmm.
Because
Hmm.
we have to prove to the insurance that you have all this other things,
Hmm.
documents.
Yes.
But with the DPC model, because we have access to membership labs,
Hmm.
patients can actually choose to pay for certain tests.
Yeah.
I will advise my patients and say, hey, I don't think you really need this, or I think you need that.
Hmm.
But at the end of the day, if they really want a certain test, they can get it because they're paying for it, and it's
Yeah.
affordable, right? It's very affordable even compared to the insurance model, how it works.
Yes. Yes.
So yeah, I've had several patients who tried to get certain tests in the traditional system, couldn't get it,
Not
and came
possible.
to me, and we were able to get it at a deep discount on top of that.
Fantastic. Yeah. Well, I also notice when I, of course, care for patients who are referred by DPC providers
Mhm.
that the evaluation is very in depth. The DPC physician has already done quite a lot of not a lot of testing, but quite a lot of detail, has taken a detailed history,
Right.
done the required testing, and definitely sometimes more, also had time to evaluate the patient to see if it could be something else. There's that time for evaluation. And when they send them to you, it's like, I've done this, I've done this, I've done this. Okay, at this point, I need you to do this or that,
Right.
which is, I find, is very different to, I would say, more conventional, traditional insurance where time is a factor, where very often the patient is referred and they don't even know why they're referred. They were like, I was in the office, I was in there for 20 minutes, they gave me this sheet, they said your name, and here I am. And very often that workup hasn't been done. Not
Right.
the fault of the physician, excellent physician, just a fault of the system.
Right.
And so in today's day and age, if you have the opportunity to get better health care, I'm really just trying to say it doesn't mean necessarily getting a more expensive insurance. It really means finding a provider, a physician, someone like Dr. Okoye or in the DPC model, which I mean, I think is really phenomenal, who's going to take the time. These are, I think, physicians who have selectively selected themselves. Like, when you find
Yeah.
a DPC doc, they're usually super great, they're super smart, and they've decided how they want to practice medicine on their own terms to really serve their patients and serve their community. So it's phenomenal. So I'm bringing this up because you guys are always asking me, I need a new doc, I need a new doc, and very often you'll hear me say, I recommend a DPC doc because if I was going to do it, I would go the way of a DPC doctor. What about all the preventative tests, right,
Yes.
doc? I just want to make sure that patients also realize it's the same care, probably just notches higher. But what about
Yeah.
preventative testing?
Yes. So the same thing. It's the same exact thing. The guidelines for preventative, screenings are not different because the practice model is different. So we DPC doctors will still order your routine mammogram. We'll still refer you for your colonoscopies. We'll still order your routine annual blood work. So yeah, it's pretty much the same
The
thing.
same
And
trend.
then for the patients who have insurance, they can decide if they want to use their insurance for the preventative screenings because
Okay.
insurance will pay 100% for preventative
Screenings
screenings.
and preventative.
And
Okay.
if they don't have insurance, then we have the discounted pricing for it.
Okay. So you accept insured patients and non-insured, or we say self-insured patient,
Yes.
insured patients, right? And
Yes.
so, the patients who are coming to you are people who have decided,
Yes.
not because they have insurance, but they've decided that they want better value in their care. It's not that
Absolutely.
you just decide, I'm not going to accept you because you have insurance. You take patients who have insurance and whatever, testing you can do get it covered under insurance, you will do.
Right.
But you just offer a different level of care that these patients are seeking to have
Exactly.
better health care. So
Exactly.
yeah,
I have several patients with excellent insurance,
yeah,
even a few with more than one insurance.
yeah,
But they choose this model because they know the value that they get and they pay that monthly membership fee
yeah.
and they know what they're getting in terms of value. And
Smart.
so that's the reason why those patients choose this model.
Very
So,
smart. And
yeah.
sometimes, we talk about the healthcare is very important and the quality of care is very important. But
Right.
the numbers are important, doc. The finances are important, right? The money is very important. So sometimes patients feel, well, I'm already paying $900 a month for my insurance, or
Yeah.
I'm already paying, $1,000 or, 1,500 because I have three kids and,
Right.
this is the deal. And so I don't want to pay additionally for this DPC doc uh, membership.
Right.
However, I'm sure if you calculate the extra amount that you spend in lab testing, in extra amount that is billed for imaging testing,
Yep.
extra amount that's billed for maybe diagnostic procedures like colonoscopy, you
Your
end up
co-pays.
losing, and your copays that's collected all the time, and of course that high deductible that you have to meet, you probably end up paying way more. That money would have probably paid for maybe just even 20 or 30% of a DPC bill,
Yes.
right?
Yes. You're
It would have
absolutely
covered
right.
it and also reduced your savings. So look at that difference in cost and where you would actually be making the savings, not only in terms of your healthcare, but also in terms of the labs and imaging. And when you look at insurance, insurance is, I'm not saying insurance is bad. I'm not saying that, but think about it. It doesn't quite make sense. Okay. It
Does
doesn't quite make sense. Yeah. So the value is tremendous. And I think you will also find that a lot of excellent physicians, excellent primary care doctors, or specialists are leaning towards the DPC model, right? They are. They really are. So let's jump away from that DPC conversation because you know I'm sold, right? I'm hoping
Yeah.
that my patients really understand this model. And if you guys have questions, guys, just go ahead and post it in the comments. We'd be glad to answer. And Dr. Chinelo, okay, Okoye, I believe are you the president of, or I think you are actively
Yes.
involved in the DPC community here in Houston and maybe in Texas at large, right?
Yes, yes. In the Houston area, I am the president of the Direct Care Physicians of Greater Houston, Texas. We're a
Okay.
formal organization of direct primary care physicians in the area.
Okay,
So,
excellent,
yeah.
excellent. Okay, great. So let's just talk about, since it's March is Colon Cancer Awareness Month, I just wanted to hear a little bit from a primary care doc, excellent as yourself, about how do you get into the conversation with patients about screening colonoscopies when they hit 45 and
Mhm.
it's time? How do you start the conversation? And what's the general feedback from your patients? You know, I'm going to ask you about Cologuard versus colonoscopy, right?
Yeah, yeah. Yeah, so I'm always talking about screenings. Anytime I see a new patient, before we even get into what brings you here,
Hmm.
we go through all their routine screenings, and that's of course because I have the time with my practice model to do that. So I want to make sure I ask about your last mammogram, your last pap smear, when have you had a colonoscopy, things like that. And then if they've had one, okay, what was found? When are you due for the next one?
Hmm.
So yeah, I am constantly talking about screening, and then of course when they come for their annual physicals,
Hmm.
we always get into all the screenings that they're due for. So yeah, so the colonoscopy, just like you said, we definitely recommend starting at age 45 because that's what the guidelines say.
Hmm.
But of course, patients who have a family history of colon cancer, first degree relative at a younger age, we want those patients to get a screening colonoscopy earlier, right?
Hmm.
So
Hmm.
if your dad had colon cancer at 45, you need to be having your colonoscopy at 35, in your
Got it.
30s,
Yep.
right? You would agree with that, correct?
100%. Yes.
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 So,
Yes.
so
And
yeah,
what's the resistance from patients?
yes, good question. Of course, as you know, the Cologuard is the gold. I mean, the colonoscopy is the gold standard. I'm
Oh,
sorry,
you almost said Cologuard.
I almost said
I was about
Cologuard.
to shut down the
No, no, no.
studio.
Sorry,
I
I
was
I
about
just
to
had
shut it
a
down.
little brain a brain freeze.
No,
So
I got you. I got you.
colonoscopy is the gold standard, and I'll say it
Yes.
again. Colonoscopy is the gold standard, and I tell patients this all the time.
Hmm.
Nothing beats having a doctor actually go in with a camera to look
Hmm.
through your entire colon to look for polyps, identify them, and take them out.
Hmm.
Right. And
Hmm.
so that's always what I try to get my patients to get. And most of the patients will go through with it, but every so often we have a few patients who, you know, are hesitant because either they're scared of the procedure or they, simply don't have the time to go
Yeah.
through it and stuff like that. And then that's where, in those type of cases, I might offer them the Cologuard.
Okay.
But I think the data is pretty clear that
Yeah.
the colonoscopy has the highest sensitivity,
Yes.
specificity, positive predictive value, all the measures that we look for in any kind of testing.
Right. Right. Right.
Nothing beats the colonoscopy. Right?
Exactly. But I think it's still good that there is something almost like a first step, a
Yes.
first line, that if patients can't do the colonoscopy for whatever reason, they
Right.
get the Cologuard. But something that I just want to highlight, since we're having this conversation in general, for
Hmm.
our audience out there, is that the Cologuard is for the 45-year-old patient who does not have a family history, has
Hmm.
never had polyps. They themselves have never had colon cancer. They don't have symptoms, no diarrhea, abdominal pain, rectal bleeding. It really is a test for the 45-year-old
Yeah.
who has no symptoms, is just kind of like just coming in for a checkup, really no symptoms, no family history. So it's a specific population that it's for. And so if
Right.
you are not in that population, don't do the Cologuard. Go straight to colonoscopy and don't fight with your doctor about getting the test because your doctor is trying to order the best test for you,
Yes,
based on all
absolutely.
of that. Yeah, based on all of that. This is fantastic. Okay, so now I understand why, that the battle about the colonoscopy, it happens with the primary care doctor just like it happens with us. Patients, I don't want to do it. I don't want to do the
Yeah,
colonoscopy.
yeah. So people are, I think some people are scared. There are a few
Yes,
patients who are scared of maybe the
anesthesia.
anesthesia,
Yes.
and things like that. But we always try to encourage the patients to go for their colonoscopies.
Excellent, excellent. That's what I love to hear. Okay, Doc. So it has been so wonderful talking to you and really learning about DPC. And thank you for the work that you're doing with the DPC community here in Houston. Now, if people are looking for you for themselves or for a
Yeah.
family member, where can they find you?
Okay, so my practice is Katy Premier Primary Care, and the website is www.katyppc, katyppc.com. So
Okay.
that's and if you're looking for a direct primary care physician in your area, there is a mapper called DPC Mapper, and I
Okay.
don't have the exact link, but if you just Google DPC Mapper,
Hmm.
MAPPER, it'll come up, and that's a search tool that has a lot of listing of a lot of direct primary care physicians in the entire country.
And
So
you would just put in your zip code,
yeah,
perhaps, or the city that you're in, and
yes,
it will map out who's closest to you.
right.
Fantastic. Okay. All right. Great. And family, we will post Dr. Okoye's information, her website, and her contact information in the comments. Okay. So stay tuned. But Dr. Okoye, thank you so much for sharing a little bit about your practice, the DPC model. I'm sold. And thank you for the work you're doing with patients here in the Houston community.
Thank you so much. Thank you for having me.
You're welcome. All right, family, natural gut relief. Again, this was another wonderful episode of Back to Basics for all of those of you who kept asking about primary care doctors and where to find a good provider. We have an excellent resource right here in Katy, Houston. The DPC model is one that I believe works very well. I've even seen some specialists going into the DPC model as well. So just really take a minute, think about your healthcare, think about your values moving forward in 2024. What's important to you and your family in terms of care, overall preventative care. Thank you so much for watching us tonight. Another episode of Back to Basics on Natural Gut Relief. My name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist in Katy, Texas. Have a wonderful evening, guys. Bye.
Bye bye.